All right, well, good morning, everybody, and welcome to our training today on Medicaid eligibility feed to CDS. This is part one of a two-part series. That being said, as always, when there are questions, we've got folks both at Orion as well as DBH and your agency and super users who will continue to offer and extend technical assistance with any questions that you might have. But today we want to be able to give a high-level overview of what the Medicaid eligibility feed is going to accomplish and some of the ways in which we will be able to achieve that. So we've got folks on mute so that way we can go through. We are recording today's training. We've got 2 hours here. We will offer ample time at the end of the presentation to be able to collect your questions that you might have. We'll be using those questions to be able to design our part two of this series so that way we can best address all of those specific questions. Part two of this series will also include more detailed description of the actual processing of how the Medicaid eligibility feed will work, as well as a demonstration in our test environment. So today we'll give you a high-level overview, and again, we'll be able to get your questions, and we will ask that you provide questions via the chat. We will be using the record feature to be able to collect those questions, to be able to, again, incorporate those into part two. We will also be looking to put together an FAQ sheet. This PowerPoint, this recording, the part two PowerPoint and the part two recording, along with that FAQ, will all eventually land themselves in the system documentation and training section of the CDS. We look to have this training and the PowerPoint into the system documentation and training no later than next Friday. We expect it will likely be before, but wanted to make sure if you've got folks who are not able to join, that you are letting them know to be looking in that system documentation section for the resource Medicaid eligibility feed to CDS series. With that being said, we'll go ahead and get started. This is Heather Wood here at the Division of Behavioral Health, and I thank you for joining us. And we want to give you just kind of some general background about what the purpose is. Many folks might remember back when we had a contract with Magellan Behavioral Health, we actually, on the TADS report, had a feature that had MRO yes, MRO no. When Medicaid became managed care and at risk, that eligibility feed changed and we no longer had access to that information directly to our system. We have been working directly with Medicaid to be able to reactivate that ability so that way it helps to be able to have a more cohesive and comprehensive way of being able to have and establish that information for providers. We understand it's difficult when providers might be bouncing back and forth with eligibility, and so we're working with Medicaid to be able to really make sure that we do have a complete and accurate method for identifying Medicaid eligibility that enables us to establish and to ensure the most appropriate funding source for services is used by both Medicaid long-term care, managed care, as well as the Division of Behavioral Health. And this eligibility feed will accompany but does not replace the other current Medicaid resources such as C1 or the NIMS line that you use to be able to understand and to be able to have up-to-date information on current consumer eligibility status. So a reminder of current expectations, and that's really that as we went to the CDS and we didn't have the Magellan shared contract with Medicaid anymore with authorization, it really became evident and it really became important that providers have an understanding and track member eligibility so that way you can secure the necessary authorization needed to make sure that you're able to get paid for the services provided through the appropriate funding source. And that's even when a member's eligibility changes during the course of a treatment episode, and we know that that does happen. Sometimes it happens multiple times across somebody's service treatment. Providers are accountable for accurately identifying, seeking authorization, and also billing the appropriate payer source depending on what that member's current eligibility status would be. The Division of Behavioral Health is the payer of last resort, and shall not pay for Medicaid-eligible services provided to Medicaid consumers for those services to be shared. And we'll get into what those services really consist of in a moment. So if you have more questions or information that you're uncertain about with the eligibility criteria for whether someone is eligible for DBH or region funding, please contact your region super user or your network director with any of those questions. There are different billing basic documents that get into more of the specifics, particularly for the fee-for-service, et cetera. So those expectations are laid out and will not be covered in full in this training, nor will it be covered in full in the next one. If you do have questions, you're welcome to, via the chat, be able to insert those questions along the way throughout this training. And I do have one note that there is no audio, so if folks are able to hear me, if someone or a couple of you might just in the chat window confirm that you in fact can hear this training session, that would be extremely helpful. Thank you very much, Lance. All right, I've gotten word that you do hear me. Thank you for the confirmation. So moving on, we'll cover what are the shared services between Medicaid and DBH that will actually be covered by this eligibility feed information. Those shared services include ACT, day rehab, day treatment, psych res rehab, secure residential, both acute and subacute inpatient, medication management, outpatient, both on the mental health and substance use side at individual, group, and family dynamics, assessment, social detox, intensive outpatient, short-term residential, dual disorder residential, therapeutic community, intermediate residential for substance use, and also community support, mental health, and substance use, as well as halfway house. So how will it work? What will happen is we will use the same files that are currently sent through a secure transmission to the Heritage Health enrollment brokerages, so that we'll be using the same enrollment file for consumer member status on eligibility that the Heritage Health plans are using, in addition to the Medicaid provider file for all of the information related to their network of Medicaid eligible providers. So there are two different data files that will be used in combination in order for the Medicaid eligibility feed to work. The files will be checked against provider information that's submitted to the centralized data system. We receive our contracted services and provider locations directly from the new DBH electronic billing system. As those are entered, they come across and they generate those services within the centralized data system. Those then are viewable and selectable both when you begin an initial encounter as well as when you are going through and doing your tasks. That information then gets submitted to the EBS, and that is the direct source of provider information that will be used and will be checked against on the Medicaid provider file. Additionally, we have consumer fields that are entered for all of the treatment services. That will be the information that is checked across the same file that the Heritage Health plans receive on the consumer eligibility enrollment file. The Medicaid start and end dates for consumers will also be included against checks, so that way the CDS date fields and activities will be reviewed against those eligibility start and end dates. The shared services will be checked for Medicaid enrolled service providers at admission, at authorization, at any continued stay review needed for continued authorization, at the quarterly continued care reviews, and then on the monthly TADs. I'll give you a couple of examples of what that might look like if it comes up that if you are a Medicaid enrolled provider and you have a consumer who, within the time frame that you are working within, has a Medicaid eligibility, you will see. For the authorization, it will look something like this, where we have Medicaid criteria as an actual denial reason on the authorization, indicating the date of that eligibility. That being said, if you are seeking an authorization and the actual admission date differs in such a way that the individual at the time period of that admission to discharge that you are looking to include in the centralized data system would in fact fall out of that eligibility time period for the Medicaid, then you would be able to submit an appeal and we would be able to process through that. The other place, another example, is on the monthly tags. If an individual is Medicaid eligible or there's no authorization, you will see notice on the tags that actually prevent any entry and submission of those units to the EBS for payment given the individual is Medicaid eligible during that month time period. So a couple of reminders. Again, providers are accountable for accurately identifying and seeking authorization and billing the appropriate payer source depending on ongoing current member eligibility. So be checking that C1 line, the NIMS line, talking with the consumers, and then this will be a secondary or tertiary ability to check on that consumer eligibility. When a consumer's eligibility changes to Medicaid, it is expected that a consumer would be discharged from the centralized data system and the appropriate, if necessary, authorization process through the Medicaid plan would be sought for reimbursement moving forward. If someone is Medicaid eligible and they do not meet medical criteria, that does not guarantee nor does that mean that they can then be in turn put into the CDS for an authorization and for payment when they are in fact Medicaid eligible. There's a process that Medicaid has for any sort of denials, and that process would need to be followed so that way the appropriate payer source could in fact be determined for the payment of that service. One of the things that is also occurring in July is an update in the discharge type to include change in funding. So when you have individuals that are becoming Medicaid eligible, or maybe they receive insurance now, and so there is still that change of funding to which you will no longer be charging or be submitting payment requests through the region to DBH. This will be the option that you use. If someone is already discharging, you would still move forward with the typical discharge type that you would have already proceeded with. But this does give you another option when you are discharging them in CDS solely due to the change in funding. So thinking about the future with your billings, there's a lot that's going on with the EBS. We've had our fiscal team, Pat Roberts and Karen Harker, that have been going out and that have been giving instruction on the electronic billing system. And so if you have questions about that, please feel free to move forward with those resources that have been provided, or contact your region super users or fiscal managers who can send you on to the appropriate source for any EBS questions. There's staff there ready and equipped to help guide and to be able to give you support with your questions that you might have as we are approaching July 24th and the implementation of this. We want folks to be set up for those July billings that will be processed that first week in August. So if there are things don't seem to be working right, we ask that you anticipate, you get in, you check your fiscal year 18 contracts. Yes, you can look at those based on what are available options for each location by the encounter as well as on the tags. If you run into issues of what you're seeing on the CDS, please let us know. You can either send a help ticket through the Orion Help Desk, or you can reach out to either the DBH data team or the EBS. On our last slide, we've got those resources for you so that way you can use those. One of the other things that we wanted to make sure that we were not doing was bombarding providers with a whole series of changes all within 1 week. So we've got some updates for our annual updates into the CDS, and we have on that tomorrow morning from 9 to 10 Central Time. But also with the implementation of the EBS scheduled, we wanted to make sure that with the Medicaid eligibility becoming operational, we were mindful of that and allowing you to get through that July billing that first week of August. So we are targeting mid-August to be able to have the Medicaid eligibility feed operational so that that way we have several weeks to be able to have you get in, look to see what consumers you might have in the CDS who might be impacted for those August billings so that we can work through that process. You can make any adjustments as needed prior to the first weekend when you go to do your billings. So I know that this is a lot of information. Again, just a reminder, this is something that we actually had more directly in place in the past with Magellan. So what we are looking is to be able to recreate and to be able to have that information become active again at the time that you are putting together your DBH region billings in the CDS through the use of the TADS form. So, again, I had said that we would have time for you to be able to offer some different questions, things that you might not quite be clear on, so that that way we can capture those and ensure that we include those in our Part 2 training. Right now, we are looking to secure a room to be able to conduct the training and fine-tuning when that training might be. We're looking at either the last week in July or the second week in August. Approximately August 8th that week. So if you have preference, you can also note that. But we will be getting information out along with an invite to you and the WebEx to be able to set that up once we land this week on a date for that second training. So again, if you have questions, we will keep this line open and we'll be able to take those questions to be able to speak specifically to them in Part 2. In the system documentation and training site, you can go to the home page and in the upper right corner, you will see your name. If you click on that, you will have a menu that you can select from. One of those is the link for the system documentation and training section. In this section, we will have all of the different trainings that will be posted. We're looking to have the trainings from this week posted no later than next Friday. We will be loading the PowerPoints for each training, following any edits that might be captured or needs that might be made immediately, but looking to have the PowerPoints loaded within 24 hours following our trainings. So both of those will become available. I know I had some folks reach out and said that they would not be available to attend today's live webinar. So certainly the recording is an option, as is the PowerPoint presentation to review. We've got contact numbers and reminders in the PowerPoint presentation here to be able to assist and direct you. If you have specific questions and you're running into issues, feel free to reach out to myself or to Bob Boussard. We've included both our email as well as our phone number. We want you to feel set up for success as all of this is going through. But we do ask that if you've got any questions that following this presentation you might think of that you would want included, go ahead and just email those questions to us so that that way we can roll those into the Part 2 training. And with that, that actually concludes our high-level overview of what the Medicaid eligibility feed to the CDS will look to accomplish, the purpose, and how it will work. Again, we will get into the actual specific details of what that will look like for you all, but I do want to give you this heads up. I do want you to be planning, and I do want you to be looking at your fiscal contracts and the service alignment to the service locations so that that way, leading into the implementation of EBS, all of that can be sorted out so that you can effectively do your July billings from the CDS to the EBS interaction, as well as be prepared for mid-August, the implementation of the Medicaid eligibility feed. That being said, there will be some additional information related to contract location on the provider side that we will be putting together notice and needing confirmation from folks related to different Medicaid provider information, such as your 11-digit taxonomy, the NPI, and also your ZIP +4. If you do not have any clue what I'm talking about, please be asking around in your payroll office and in your billing office for folks who are familiar with the impact of those fields as they use them to actually be able to bill for Medicaid payment. So again, we'll keep the line open here, and if there are any questions, please feel free to type them, and we will capture those. We will stay on until we don't see any additional questions for 5 minutes or so. So please feel free to type in those questions. You can do it privately so that way others may not see that question, but we can capture it and make sure to include it in Part 2. I thank you for your time this morning, and